Welcome, aspirants. Today, we're going to break down a super important topic for your CSS and PMS exams, population planning. And let me tell you, this isn't just about counting people. It's a core piece of national strategy, and really getting it is key to acing your papers.
Okay, let's just dive right in with the big question, the one that policymakers, especially in places like Pakistan, are wrestling with every single day. Is having a massive population an engine for growth, a demographic dividend? Or is it a huge strain on resources, a real dilemma? Seriously, how a nation answers this shapes its entire future. So here's our game plan for this explainer. We'll start with the blueprint itself. What is population planning? Then we'll look at its main tool, which is family planning. After that, we'll check out the impact, figure out the biggest obstacles, and finally, talk about the solutions. Right. Section 1. The blueprint. Before we get into all the nitty-gritty details, we absolutely need a rock-solid, exam-ready definition of what population planning actually means from a government's point of view.
Okay, this is the crucial part, so listen up. Population planning is not just about population control. It's a whole national strategy. It's all about finding that perfect balance between how many people you have and the resources you have for them. The whole goal is to create sustainable development and a better quality of life for everybody. So why does this matter so much? Well, these core objectives, they really tell the whole story. These aren't just bullet points. They are the key performance indicators for any developing nation. From boosting the economy to protecting the environment and making sure you have enough water and food for the future, every single one of these goals is tied directly to how well you manage your population.
Okay, so we have this big, grand strategy. But how do you actually make it happen? How do you take a national blueprint and turn it into action on the ground? Well, the answer is in its primary tool.
For your exam, you have to be crystal clear on this relationship. Population planning is the big picture policy. It's the what and the why. Family planning, on the other hand, is the set of practical tools and services that get the job done. It's the how. Think of it as the operational arm of the whole strategy. Now, what's great about this table is how it breaks down the family planning toolbox. An examiner could easily ask you to classify these methods. So you've got your hormonal methods, barrier methods, then you have LARCs, that's long-acting, reversible contraceptives, for long-term but not permanent solutions, and finally, permanent surgical options. This is a perfect slide to screenshot for revision. And here's a classic trap you might see in an MCQ. People often get the permanent methods mixed up. This lays it out so clearly. Just remember, a vasectomy is for males, and it's generally simpler and less invasive. Tubal ligation is for females, and it's a more complex surgery. Knowing these little details really shows an examiner that you know your stuff. So, we've got the strategy and we've got the tools. But what's the payoff? What actually happens when these things are implemented successfully? Let's follow the benefits as they ripple out across society, starting from the individual and moving all the way up to the nation. The impact starts right at the heart of it all, with mothers and children. When family planning works, it directly cuts down on maternal and infant deaths by allowing healthier spacing between kids. And crucially, it empowers women. It gives them control, which then opens up all these other doors to education and jobs.
And these individual benefits, they start to add up. For families, being able to plan means they can manage their money better, which can literally lift them out of poverty. Then, at the community level, you see less pressure on schools, on hospitals, and that means better public health for everyone. And finally, this all builds up to massive benefits for the entire nation. For a country like Pakistan, managing population growth takes huge pressure off critical resources like water. It lowers the country's carbon footprint, and, most importantly, it paves the way for real, long-term, sustainable economic growth.
But if the benefits are so obvious, why isn't this working perfectly everywhere? That's the big question, right? The truth is, there's a major roadblock, a huge gap between what we want to do and what's actually happening. This number says it all. 218 million. That is the number of women in developing countries who want to avoid getting pregnant but aren't using modern contraception. This is what we call the unmet need. And this chart shows you exactly where that need is concentrated. The numbers are just staggering. More than half of all women with this unmet need live in just two places: Sub-Saharan Africa and right here in our own backyard, South Asia. This makes it an incredibly urgent problem for us to solve. Now, to get those top marks in your exam, you can't just give one reason for this gap.
You have to show you get how complex it is. It's not just one thing. It's a mix of not having access to clinics, it's about deep cultural beliefs, a lack of education, a weak healthcare system, and, this is a big one, gender dynamics that stop women from making their own choices.
So, thinking like a future policymaker, which you all are, you have to be a problem solver. It's not enough to just point out the problem. So what are the actual strategies we can use to close this critical gap?
Look, there's no silver bullet. The solution has to be a full-court press, hitting the problem from every angle. We're talking about massive education campaigns, making services easier to get to and more affordable, fixing the entire healthcare system, talking with communities in a way that respects their culture, and tying it all together with strong government policies.
And let's end with this thought, because it brings everything we've talked about right back home to Pakistan's biggest reality. We have this huge young population, the youth bulge. Right now, it can feel like a massive strain. But with smart population planning, with real investment in health and education, could we turn it into our greatest strategic asset? That is the challenge, and that is the opportunity for you.